What does back labor feel like? Well, it hurts, like really, really hurts. So as a mom, I also had back labor. So I'm just going to kind of give you some information so that you can understand a little bit more as to why your body reacts that way. So the first thing is you have to take a look at the baby's position, right? So back labor can be caused because of baby's position, the size and the shape of the mother's pelvis area, and then also weak abdominal muscles, okay? And so again, the positioning of the baby, as you kind of tilt back and forth, and your labor and delivery room nurse will help you. And again, as you're doing that, you're trying to move the baby down into the birthing canal. But what happens is, if the position of the baby is what we call sunny side up, then it's going to cause a lot of back labor. Let me explain. Okay, so the face is nice and squishy. And when the face is nice and squishy, if it's laying on the mother's back, guess what? She doesn't feel it. Why? Because it's a squishy baby face. Versus the skull or the head of the baby. If the head of the baby is rubbing on the mother's back, aka sunny side up, so the other way, then that will cause a lot of significant back labor and pain. And obviously, as I go and do epidurals inside these mothers, it's really difficult for them to understand that the position of the baby, that if it is truly back labor, it'll get worse with each contraction. But when they have an epidural and they're saying that they're sensing or feeling this intense back pain, it's actually pressure. And I'm going to use the example. If I were to push really hard, okay, on any place of your body, and then I let go, look how the blood returns to it. But for that moment, the medication and or the blood wasn't getting there. So as soon as that's released, hence why we flip the mothers back and forth, or side to side, I should say. Once we do that, that allows the medication to get exactly where it's needed, and they won't have any more trouble giving birth via back labor. But it really hurts. It's like horrible sciatic pressure. One thing that you can do, grab a tennis ball, dads, or get like a can of Coca-Cola, something that's nice and cool too, and just rub it and help to rub on that lower part of the back, especially when moms are having that back labor. Did you puke during your delivery? Well, NoMo with NoMo Nausea, the first essential oil infused acupressure wristband that instantly stops pregnant moms during delivery, whether that's C-section or vaginal delivery, from having those horrible upset stomach and giving up their cookies. Because let's be real, you're already hungry enough and you don't want to lose any extra calories. Go buy one today. Now, if you're a mama or if you know somebody who's pregnant, make sure you go to Amazon right now, get a NoMo Nausea band. What these are, they are found in hospitals, but not in every one. And trust me, you don't want to be the one that ends up puking. So it stops 80% of women from having nausea or vomiting instantly, all by utilizing pressure and essential oil of peppermint. So go grab them. $10 can totally save your entire epidural and labor experience.